first and foremost, let me tell you, if a patient is coming to you with a diagnosis in mind, as soon as the patient enters my cabin, I tell them, please don't tell me your diagnosis, and I don't want to see your reports or your X-ray or your MRI. I want to listen to your story, because 99% of the times we get the diagnosis in the patient's story.
Okay.
Or what we call as a history-taking art. Art which is forgotten by today's generation. Most of my times that I see a patient and talk to the patient himself comes out with a diagnosis for me to keep in mind. I don't see the reports, I don't see the investigations. I then examine my patient and confirm that diagnosis. And once I have confirmed the diagnosis on clinical examination, again an art which is very well forgotten by generation which is practicing now. Only then I have a look at the investigations to confirm, and then I sit and talk to the patient. Now, if you had an injury, or if you have a meniscus tear or an ACL tear, or even an arthritis, or even a shoulder injury, if and only if your investigations are matching your symptoms, would I convince you for surgery, or would I explain to you? But if you have a tear in your meniscus, but you have no pain or no symptoms, I am not going to treat the investigations. I have to treat you. Take for example my situation. I am an orthopedic surgeon who's doing a lot of arthroscopies and replacements. I have to bend forward, pick up heavy decks. If I go ahead today and do an MRI of my spine, there will be multiple disc prolapse. But that doesn't mean that I'm going to go and get a surgery done unless and until I have symptoms and signs which then relate to my investigation. Am I going to opt for surgery? Similarly, I treat all my patients that way. Secondly, I would do only those surgeries which I would do for my relatives. So if I feel that my mom, unfortunately she's passed away, but if she had an issue, how would I tackle that? Is how I would tackle an old lady coming to me. Or my brother or my sister. I exactly look at my position and say, what would I do for my brother? Or what would I do for my sister? That is exactly how I would treat my patient.